Hi everyone. So today, once again, I'm reading an article on the Huffington Post entitled, "Why Are You Questioning My Need for a Wheelchair?" This issue seems to be in the media a lot lately, which is actually good because it's helping bring awareness to the struggles of people with invisible diseases and the things they have to endure from people who don't understand what any of us are dealing with, who think they have the right to come and question our need for uh, wheelchairs and disabled parking placards. I don't understand this sense of privilege that people have in coming up to people they know nothing about, making judgments about them, and then some getting very aggressive, like the woman in the story I posted about last week who was actually almost physically abused because someone thought she wasn't deserving of parking in a handicapped space, even though she has two handicapped children that this person didn't see. These things are so upsetting. What really gets to me is if you read these articles on sites like the Huffington Post, the people who write them, this gal wrote an excellent piece about how she feels when she's verbally assaulted, in my opinion, in parking lots because they think she's too young to be in a wheelchair or she's too pretty to be in a wheelchair, and ask her why she's in a wheelchair and what are you doing in a wheelchair and things of that nature. And people who post replies to these articles are just astonishing to me in their assumption that everyone who doesn't fit their personal criteria of what a disability is means they get to decide whether that person is worthy or not. It's just astonishing that so many people have such a strong reaction when they don't see a person that they can determine is clearly, in their eyes, physically disabled. It's really disturbing. I mean, I think, you could say on the one hand, they're trying to look out for people who they think are entitled to use handicapped parking spaces. And so they're just trying to, make sure that somebody isn't abusing them. You know, that's a good thought, and I'd like to think that they have the best of intentions. But when people approach strangers in parking lots and in public places and just start accusing them of taking advantage of privileges that they feel we aren't entitled to, is just really sad and pitiful, in my opinion. I don't understand it. I don't understand why they think it's any of their business. Someone actually posted in the comments section on this story that they felt that it was their business to speak up if they felt that someone, was abusing the privilege. I just don't understand that thought process, and no one will ever convince me that it's their business to intervene. This assumption that there is rampant abuse of things like handicapped parking placards is way overblown. There is abuse, yes, but when you see someone who you can't reconcile in your mind that they are disabled, doesn't mean that they are one of the abusers. And frankly, it's none of your business. There are doctors, of course, who will sign paperwork without any thought to whether or not the person really needs the handicap parking placard or not. My doctor is a straight arrow. He is the kind of guy who, if he felt I didn't need a handicap parking placard, he would have had no qualms about telling me to my face that, that's just something I'm not comfortable filling out paperwork for. I think you can manage without it, and I'm just not going to do this. When I asked my doctor about getting one, he told me that A, yes, he felt I was more than deserving, but B, he didn't know whether or not the state would think I was deserving based on the standard criteria that they use to measure whether or not someone is in need. The criteria, I know, can vary from state to state, but in general, it tends toward the archaic and to not acknowledging people with invisible diseases, and their basis for approval is fairly harsh in most circumstances, regardless of what your doctor writes, and it's not so easy to get a parking placard. So, you know, do family members take one and use it that somebody got legitimately? That probably happens, and I don't approve of that. My mother takes me places, and we use my parking placard when she is driving me someplace. She would never, even when she had her knee replacement surgery, she would never borrow my placard. She could have got a temporary one herself, but she didn't even bother with that. It's just really something that has been really bothering me. I think it bothers a lot of us. And because it was National Invisible Chronic Illness Awareness Week this past week, I think that's why I saw several articles recently about topics similar to this. I really can't understand why someone would make an assumption about someone in a wheelchair and accuse them of not needing it. That one really blows my mind. This poor girl who wrote this story was subjected to verbal, accusations in public that no one would have any right ever making. If you see someone in a wheelchair, why would you ever assume that they would be in it for unnecessary reasons? I just don't understand that. I know I'm rambling a little bit, but this was just something I felt I had to speak about yet again, because the question I asked in my last blog on this topic was, who gets to decide? Well, the answer to that question is our doctors and the state get to decide whether or not we're entitled to a handicapped parking placard. I think the assumption of rampant abuse is way overblown. And in fact, in my state, unfortunately, my state legislature feels there is so much abuse that they passed a law, and every one of us in the state of Illinois has received a letter notifying us that now there are 2 types of handicap parking placards that will be given out, and we all have to reapply depending on which type we feel we need. Apparently, I was not even aware of this and would never have even done this, but apparently in Illinois it has been legal, if you have a handicap parking placard, to park in a handicap parking space that has a parking meter that you would normally need to put money into and not have to pay. I was not aware of that. I don't go anywhere where I park at parking meters, but if I did, I would have fed the meter because I would not have known that I had the privilege not to. But the state apparently has decided that this is a rampant abuse problem here, and so now they have to have us classify ourselves into 2 categories. Those of us that can have legitimate reason to park in a space and not feed the meter, like people in wheelchairs who can't reach the meters and things of that nature. They're perfectly entitled, in my opinion, to park for free because no one's designed parking meters that they're able to reach and access, and so they shouldn't have to pay. Now, I'm one of those people who has a handicap parking placard, but I am capable of reaching a meter and feeding it, and so I always would have done that. But again, this assumption that there is rampant abuse, I can't find documentation and substantive proof that this abuse exists. I know that in Chicago they've done sting operations to catch people. It's usually something that like even a network news will do a story on during sweeps months to get ratings, and they follow people around. You know, those of us with invisible disease who suffer from pain and find it very difficult to walk from the parking lot into, say, the grocery store or into the pharmacy or into the doctor's office without great discomfort, you know, get great benefit from having the privilege, and it is a privilege to me, to be able to park in a handicapped parking space. That said, 99% of the time when I try to find a handicapped parking space, I can't find one. So I don't even get to use my parking placard as often as I might want. The other reason someone with interstitial cystitis, like we have, those of you who read my blog are mostly IC patients, is that we need to be able to get into a bathroom as quickly as possible on a moment's notice, and to have to drive around and round and round and look for a place to park while we, you know, are in agony trying to get into a facility to use the restroom. Having a handicap parking permit makes it really easy to pull in and get out and go into wherever it is we are and use the restroom as quickly as we possibly can. So, you know, people need to just think twice before they make a judgment about somebody. I've said it before. I guess it's I'm preaching to the choir, since those of you reading my blog are all in the same boat, and I don't know how to get the word out beyond my little blog and hope that people who see this will read it and talk about it among family members that they have that understand their condition, or that they want to understand their condition, and help them realize that there are lots of people who have disabilities that can't be seen, and no one should ever make a judgment. As I said in my blog, it was about a week or so ago, I titled it, "Who Gets to Decide?" And as I said at the end, my doctor gets to decide. And you don't get to decide if you are someone who sees me parking in the parking lot and using my handicap placard. You have no business judging me whether you think you do or not. And it's cruel, it's unkind, it's thoughtless, and it's just beyond, you know, I'm out of words to describe what it is when someone gets aggressive towards someone that they don't even know and know nothing about. I've often thought about what I would say to somebody if I were actually approached and spoken to like some others have been. I know I've gotten dirty looks, and I've talked about this with my therapist. She says she has a lot of patients who have handicap parking permits and have invisible diseases, and we all sort of have to get used to getting the look. But I've often thought, if someone ever approached me, what I would say to them, and I think I would ask them exactly what it is that about my medical conditions that they think is any of their business. Show them my medical alert bracelet that's on my wrist every day, and ask them which one of my many medical conditions that is really none of their business that they feel they're entitled for me to explain. Anyway, I guess I've rambled on long enough on this topic, but I see these stories, and they break my heart that people are put through this by unkind, uncaring, unthinking individuals who have no business making assumptions about us. And it's really sad to me that we live in a society that feels that they have the right to just say things to people that they have no right saying. So I'm going to say it again. Who gets to decide whether I'm entitled to a handicap parking placard or not? My doctor gets to decide, and the state of Illinois where I live gets to decide. He told me when he filled it out the first time, he said, leave the paperwork with me, let me think about it, and we'll see what happens. And that day when I walked out of his office, I kind of didn't expect anything to ever happen. I figured I'd never get a placard. You never know what happens to paperwork when you leave it with a doctor. But he actually did think about it, and he filled out the form in such a way that the state of Illinois agreed with my physician's assessment of my need and my right to have a handicap parking permit. So that means it's nobody else's business, and nobody else gets to judge me for that. And if you do want to judge me, keep it to yourself. It's not your business. It's my business, my doctor's business, and you should just keep your comments to yourself. So the issue again, who gets to decide? Our doctors get to decide. That's who gets to decide. That's it for today.